Hello everyone! Have you ever wondered about the miraculous journey our bodies take right from the start, even before we're born? As a board-certified urologist and pelvic surgeon, I'm here to dive deep into the wonders of female sexual anatomy, starting with its embryonic roots. Picture this in the womb. During those first 8 weeks of pregnancy, every fetus looks remarkably similar, regardless of whether it will develop into a male or female body. There's no distinct genitalia yet, just two key structures, the genital tubercle and the orogenital sinus. These are like blank canvases waiting to be shaped by genetics. Around the 10-week mark, things start to differentiate based on the chromosomes. If it's X, the path leads to female development. If XY, male. The genital tubercle, that tiny bump, transforms into the clitoral head in females or the penile glands in males. Meanwhile, the urogenital sinus splits accordingly, forming the vulva's openings in females or the penile shaft and urethra in males. This shared origin is why we see so many homologous structures, parts that are essentially twins in function and tissue, just arranged differently. For instance, the clitoral hood mirrors the foreskin, providing protection and sensitivity. The labia majora, those outer lips, are akin to the scrotum, both swelling with arousal and rich in nerves. Even the inner labia minora correspond to parts of the penile skin. Understanding this embryology isn't just academic, it demystifies why pleasure pathways are so similar across genders. It explains how stimulation that works for one can inspire techniques for the other, fostering empathy in intimate moments. When we grasp that these structures evolve from the same fatal tissue, it highlights the body's efficiency, evolution repurposing the same blueprint for reproduction and joy. This foundation sets the stage for appreciating the vulva's complexity, where every fold and curve has a purpose. In my practice, I've seen how this knowledge empowers people to communicate better with partners, reducing confusion and enhancing connection. It's about celebrating the body's design, not shying away from it. So, if you're curious about amping up those spicy sessions or just understanding your own anatomy, stick around. We're building from the basics to the breathtaking. And remember, whether you have a vulva or love someone who does, this info is gold for healthier, happier intimacy. Let's keep exploring because your body is worth knowing inside out. Now, shifting our focus to the star of the show, the vulva and its crown jewel, the clitoris. Everything visible externally, the folds, openings, and that sensitive peak at the top is collectively called the vulva, not to be confused with the vagina, which is internal. At the very apex sits the clitoris, a powerhouse of pleasure that's embryologically identical to the head of the penis. Packed with over 8,000 nerve endings, more than twice that of the pineal glands, it's designed purely for sensation, with no reproductive role beyond drawing us into ecstasy. The visible part, the glans, peeks out from under its protective hood called the prepuce, which can slide back and forth much like foreskin. Sometimes adhesions form here, sticking the hood to the glans and causing discomfort during stimulation. A quick medical check can resolve that. But don't be fooled by its small external appearance. The clitoris is a gateway to deeper delights. Its stimulation is crucial for orgasm in most women, just as penile touch is for men. Surrounding it are the labia, the outer majora, plush and protective like a cushion, and the inner minora, delicate and varying wildly in shape and size from person to person. No two are alike, and that's perfectly normal. These lips swell and darken with arousal, heightening sensitivity. Below the clitoris lies the urethral opening, the exit for urine from the bladder. Keep it clean to avoid infections. Then comes the vaginal entrance, elastic and adaptable. And finally, the anus at the base. This layout isn't random, it's optimized for function and fun. In intimate encounters, knowing the vulva's map means prioritizing what feels good, gentle circles on the clitoris, light teasing of the labia. Health-wise, regular self-checks here can spot changes early, like unusual discharge or lumps. As a surgeon, I've witnessed how education reduces shame. Women often come in worried about normalcy, but variety is the norm. Embrace it. This detailed view transforms confusion into confidence, making every touch more intentional. Whether solo or with a partner, exploring the vulva's nuances leads to profound satisfaction. It's not just anatomy, it's your personal pleasure landscape waiting to be navigated with care and curiosity. Let's honor it by learning more. Because when you know better, you feel better. Diving even deeper, let's uncover the hidden depths of the clitoris. It's far more than meets the eye. While the external glans is just the tip, internally this organ extends like a wishbone, with legs, crura, and bulbs wrapping around the vaginal canal and urethra. Composed of erectile tissue similar to the penis's corpora cavernosa, it fills with blood during arousal, causing swelling and increased sensitivity. This tumescence can make the entire vulvar area throb with pleasure, explaining why some feel waves radiating from the inside out. Anatomical studies, including dissections, reveal identical nerves and blood vessels to those in the penis. Think of it as an internalized version. About 3–5 inches long when fully accounted for, the bulbs hug the vaginal walls, so penetration can indirectly stimulate them, blending sensations. Right beneath the inner labia, this tissue adds to the erogenous zones, making those areas ultra responsive to touch or vibration. During excitement, the clitoris can enlarge noticeably, pulling back under its hood for protection while amplifying internal feelings. This structure covers the urethral sponge too, which some link to squirting or intense orgasms. In my videos on male arousal, like those covering sildenafil, I explain erections. Well, the clitoris undergoes the same process, just subtler. Hormonal rushes like estrogen and testosterone fuel this engorgement, promoting lubrication and rattiness. For health, good circulation here prevents atrophy, especially post-menopause. Kegel exercises strengthen the pelvic floor supporting it. But pleasure-wise, this internal network is key to multi-layered orgasms. Combine external clitoral play with internal pressure for blended bliss. Partners, take note. Ask for guidance as sensitivity varies. Self-exploration with mirrors or toys demystifies it, building body positivity. Evolutionarily, this setup ensures pleasure drives reproduction, but today it's about empowerment. I've seen patients light up when they learn this. Suddenly, their experiences make sense. No more myths of it being small. It's a vast, vibrant system. So, whether you're enhancing solo sessions or sensing with a significant other, tap into this internal wonder. It's your body's built-in joy machine, engineered for ecstasy. Keep watching as we connect this to the rest of the anatomy for a full picture of passion and health. Moving smoothly along, let's talk about the practical players, the vagina, urethra, and anus, the trio often referred to as the three holes in female anatomy. Starting with the urethra, it's that small opening just below the clitoris, serving as the bladder's outlet for urine. Short and straight, about 1.5 inches long, it's prone to UTIs if bacteria sneak in. Wipe front to back, folks. Hydration and peeing after sex keep it happy. Next, the vagina, a marvel of adaptability. This muscular canal stretches from the vulva inward, about 3–5 inches deep at rest, but expanding up to 3 inches longer and wider during arousal. Blood flow causes tenting, where the inner walls balloon for comfort during penetration or birth. It's self-cleaning with acidic pH warding off infections. But douches disrupt that. Stick to gentle soaps externally. The vagina hosts the cervix at its end, a gateway to the uterus, and during excitement, it lubricates naturally, reducing friction. Sensations here vary. The lower third is most nerve-rich, while deeper areas feel pressure more than pinpoint pleasure. Then the anus, the rectal opening, ringed by sphincters for control. It's not part of the reproductive system, but can be erogenous due to shared nerves with the vulva. Always use lube and go slow if exploring. Hygiene is key to avoid cross-contamination. Together, these structures form a symphony. Arousal integrates them, with clitoral stim often sensing vaginal response. In childbirth, the vagina's elasticity shines, accommodating a baby's head, then rebounding. Pelvic therapy aids recovery. Health tips: regular gyno visits catch issues like cysts or prolapse early. Sexually understanding expansion means better prep foreplay builds that length and wetness for enjoyable encounters. For those with vulvas, tracking cycles notes changes. Post-ovulation, it might feel drier. Partners' communication turns good into great. Ask about pace and depth. This knowledge banishes taboos, promoting safe fun. In my clinic, demystifying these reduces anxiety. Many fear looseness, but muscles tone with exercise. Embrace the versatility. From peeing efficiently to birthing life to igniting passion, these holes are multifunctional miracles. Let's appreciate their roles in wholeness, because informed intimacy is the best kind. Finally, let's unravel the mystery of the G-spot, that elusive zone sparking endless debates. Named after Ernst Gerhard Femberg in the 1940s, it's not a precise button, but a sensitive area on the anterior vaginal wall, about 1–2 inches inside. To locate it, insert a finger and curve upward. In a come hither motion, you might feel a ridged, spongy texture differing from smoother walls. This spot's magic comes from dense nerve and its proximity to the clitoris's internal extensions, plus the skin's glands, which are homologous to the male prostate. These glands produce fluid similar to prostatic secretions, potentially leading to female ejaculation or squirting when stimulated. Massage here can feel intensely pleasurable for some, mimicking prostate play in men. I've covered that in other videos. But is it the orgasm holy grail? For a minority, yes. Vaginal penetration targeting it can trigger climaxes. However, studies show most women, around 70–80%, require clitoral stimulation for orgasm, as the clitoris packs the penile equivalent punch. The G-spot enhances but rarely solo stars. During arousal, it swells, becoming more prominent. So timing matters. Experiment safely, use fingers, curved toys, or positions like doggy style for access. Communication is crucial. Feedback guides pressure and rhythm. Health note: if stimulation causes pain, see a doc. It could signal issues like cysts. Culturally, the G-spot hype sometimes pressures folks, but remember, pleasure is personal. No one's broken if it doesn't click. In my experience, education shifts focus to holistic enjoyment, blending spots for waves of sensation. Tie it back. Since the clitoris and G-spot connect via shared tissues, combined play often yields the best results. For vulva-owners, solo discovery builds confidence. For partners, it's about teamwork. Ultimately, the G-spot reminds us anatomy's full of surprises. Explore without expectations. I hope this deep dive into female sexual anatomy has enlightened you, from embryonic starts to pleasure peaks. If it sparked questions, drop them below. Subscribe for more on sexual health. Like my upcoming video on female ejaculation. Take care of yourself. You're worth it.